Hi, my name is Tanji Carr, and today I'm going to be demonstrating how we're going to go ahead and perform a central line dressing change. Now, we're assuming that I've already introduced myself to the patient and let the patient know that we're going to be, I've checked the patient. I've verified it's the right patient by having him state his name, first and last, his date of birth, and where he's at. So we know this is the right patient. We've explained to the patient that we're going to be performing a uh, a central line dressing change, so the patient's aware of that. We provided privacy. The patient is private, and now we first thing I'm going to do is prepare my materials. So I prepared and gathered my materials here. Then I'm going to go ahead and perform hand hygiene. So I have performed hand hygiene. I'm going to go ahead and then apply my mask. Okay, and then we're going to verbalize to the patient, okay, we're getting ready to begin the central line dressing change. So I either need you to turn your head away from the direction of where your central line is located, or I need to go ahead and apply a mask. So we're going to go ahead and apply a mask to the patient. Okay. All right. So then what I'm going to do is I'm going to go ahead and apply my clean gloves. And now we're going to go ahead and we're going to remove the old dressing. Okay, so with my non-dominant hand, I'm going to go ahead and just secure the catheter with my non-dominant hand. And then on each side, we're going to go ahead and loosen up the bandage. Okay, we're going to pull in line with the skin and flush. We're going to do the same thing to each side. Okay, we're still stabilizing the catheter with that non-dominant hand. Okay, and then once we removed the bandage, we're going to check to make sure that everything's intact. So we're going to check that the skin's intact. We're not going to touch though. We're going to check that there's no redness and that everything's intact. So you're going to verbalize that to the patient. And we're taking a look here, and we see that everything's intact. And there's nothing going on with the catheter there, okay? So then what we're gonna do is, after we advise the patient of that, I'm gonna go ahead, like I said, I've already inspected, and the insertion site, everything looks good. There's no drainage, there's no redness, there's no bumps, so everything looks good. So I'm gonna go ahead and remove my gloves and discard of them in the trash can. I'm gonna perform my hand hygiene again. All right, and now we're going to go into our aseptic technique. I'm going to go ahead and open my CVAD dressing kit using the technique. So I'm going to open away. Okay. I'm going to go ahead and get the sterile drape. We're going to open this so that the shiny side is down. Make sure that nothing touches. Then I'm going to go ahead and grab this pack. And I'm going to pour the contents out. All right. So now I'm going to go ahead and I'm going to grab my sterile gloves here. And you see it's still inside of the package, which is all considered sterile still. And now I'm going to go ahead and put on my sterile gloves using the aseptic technique. As long as I am touching the cuff and not touching the outside of the glove, I'm still considered sterile. So I just use the cuff here and get my gloves on like so. All right, touching the inside of the cuff on this one too. I'm going to go ahead I'm going to put the other sterile glove on. Just making sure that these gloves are actually not the right size for me, but we're going to make them work. Just all you have to do is make sure you keep your hand on the cuff and then kind of let it roll up so that you remain sterile. So now the inside of this is sterile. I'm just going to move this out of my way. And then what we're going to do is we're going to get our chlorhexidine solution. So I'm going to get that. And I'm going to go ahead, what we're going to do is we're going to use the solution to perform the aseptic wash of the site. So I'm going to go moving friction from side to side, and I'm going to go as big as the new bandage that I'm putting in. That's the amount of the area that I need to clean. So here we go. And we want to do this for at least 30 seconds. We want to make sure that we just clean all around. Back and forth, friction. In a circular motion until it's clean. And then after about 30 seconds of doing that, we want to go ahead and we want to allow this to dry completely, okay? So we want to allow it to dry completely. We've done the back and forth friction for about 30 seconds. And after we allow it to dry completely, we're going to go ahead and we're going to apply our sterile dressing. So this is what the sterile dressing looks like. Okay. So the trick that I like to do is just kind of bend it backwards so that you can disconnect it. And on the back side, you'll see two slits that let you know that that's going to be the area that's open for the catheter. All right. So now I'm going to just go ahead and apply the dressing over the site. Okay, and then you can go ahead and remove, there's an area on the top here that allows you to remove. There's like an excess part of the bandage that'll just kind of slip off there if you pull these tabs up. And then it'll allow you to fully secure the bandage to the patient. So now the area is secure. There's nothing left open to the air or infection. We're just kind of pulling the excess protectant off, but that's fully covered. And it's nice and clear, so you can see that it's clean. And now what I'm going to do is I'm going to take my Sharpie and I'm going to go ahead and I'm going to put the date, I'm going to put the time, I'm going to put my initials, and then we're going to go ahead and secure this on top of the bandage. We're going to do it right here to the bottom side so that anyone treating the patient will know what date and time this was performed, okay? So now what I'm going to do is I'm going to remove, I'm going to dispose of all of the the used supplies. Dispose of those. Actually, dispose of everything. I'm going to put those in my trash. Discard of everything. Put everything in the trash can. Then I'm going to dispose of my gloves. I'm going to perform hand hygiene. I can go ahead and remove my mask. I can remove the patient's mask now that my hands are clean again. Put him back in a semi-Fowler's position. Are you good? Yes. Put his call light next to him. And go ahead and document in the charting. And we're all done. Thank you.